Thank you very much, Mrs. John Baptist, and let me say good morning to our listeners in Dominica and in the wider global community listening to us this morning as we bring you this update on the Ministry of Health and the Environment. Today we are just 1 day short of 2 months after Hurricane Maria struck the island of Dominica. The health sector, as you heard and as we all know, is one of those that has been severely impacted by Hurricane Maria. And as you heard from our moderator this morning, the health sector is also one of those that come into sharp focus, where a lot of attention is placed post any disaster, not just hurricane. Based on the preliminary assessment of the figures of the post-disaster needs assessment that was conducted a few weeks after Hurricane Maria, our loss and damage to the health sector stands at 18.8 million EC dollars. And in terms of our needs, what we require to make the sector more resilient and to take into consideration impact of climate change, we're looking at approximately 59.7 million, we could say roughly $60 million to bring the health sector to what we would like it to be post-Hurricane Maria. This morning, I am certainly pleased to report that despite the damage that we suffered under Maria, that the health sector continued to function. One of our volunteers who came to us after Hurricane Maria indicated to me that really I see a system, and that was days after Maria, a system that is still very functional. And for this, commended the Ministry of Health, because we were able, despite the challenges, to continue most of the regular services that were provided within the Ministry of Health. I am also grateful to the number of healthcare professionals who really displayed strong heroic act to ensure that those services were maintained throughout our health system. We also recognize the contribution of our many volunteers from the various organizations, and I take it that later on in the presentation this morning, you will get an idea of all the organizations that contribute and are still contributing to ensure that the health system continues to function. Post-Hurricane Maria, we continue to focus on provision of care and treatment at our hospitals, the Princess Margaret Hospital and the Regional Armour Hospital in Portsmouth, and our health centers across the island. We also continue our focus on disease surveillance, because that is very important post any disaster. On health education, and I'm sure you have been listening to all the health education tips that we have provided you. On psychosocial support, which is very critical as our population continues to cope with the post-Maria experience. On solid waste management, on health and safety, to include occupational health and safety, among many others that the ministry continues to work on. This morning, we have a very strong, committed team from the Ministry of Health to update you on some of those matters, as well as other matters of health. We have the Honorable Minister of Health and the Environment, himself a health professional, our Chief Medical Officer, Dr. David Johnson, the Director of Primary Health Care, who is expected to join us very shortly, the Project Coordinator in the Project Management Unit for the new National Hospital, the Acting Chief Environmental Health Officer, the General Manager of the Dominica Solid Waste Management Corporation, Mr. Florian Michel. We will begin with a statement from the Honorable Minister, and that will be followed by a presentation from the Chief Medical Officer, the Chief Environmental Health Officer, the Manager of Solid Waste, and then we will invite the press to ask any questions that you wish, and then the rest of the team will also contribute at that point. Thank you. Honorable Minister.